Behind every medical treatment, there's a human story. Maggot therapy, though it may sound unusual, has given hope to many patients with wounds that simply would not heal. Let's take the example of Mrs. Pereira, a 58-year-old woman with diabetes. She developed a stubborn ulcer on her heel that refused to heal despite months of dressings, antibiotics, and routine wound care. The wound became infected and amputation was being considered. Her doctor suggested maggot therapy. At first, she was hesitant. After all, the idea of using maggots sounded frightening. But after learning that the larvae were sterile, safe, and medically approved, she agreed to give it a try. Sterile maggots were applied to her wound inside a special dressing that kept them secure. Over 48 hours, they began their natural work, removing dead tissue and cleaning the wound bed. When the dressing was removed, the change was clear. The wound looked cleaner, with healthy pink tissue starting to form. Before maggot therapy, Mrs. Pereira faced pain, infection, and the real possibility of losing her foot. After a few cycles of therapy, her wound began to close, the infection cleared, and she was able to walk again without fear. The treatment not only saved her foot, but also restored her confidence and quality of life. This story is just one example of how maggot therapy can transform lives. What begins as a last hope often becomes a powerful step toward healing and recovery. In the next episode, we'll discuss the safety of maggot therapy and address possible side effects, so you'll know exactly what to expect.